How do I know if genetic testing is right for me?
And this is a question that a lot of families have. Why does my child have seizures? And epilepsy, as you probably know, can have a lot of different causes, certain infections, an injury to the brain, structural differences of the brain, growth in the brain, autoimmune conditions. But when a non-genetic explanation has been ruled out, your doctor will probably suspect that the underlying cause of the seizures is genetic. The tricky thing about genetic testing is that not all of the genetic causes of epilepsy are known yet. So there's only a subset of children who have a positive genetic test, even though their epilepsy is probably genetic. So how do we know which kids are the best candidates for genetic testing? Genetic testing is more likely to find an answer in kids whose epilepsy is not well controlled with medication. Also in kids who have epilepsy and additional diagnoses. So these would be things like autism or developmental differences that affect a child's ability to learn in school or meet their milestones on time, like sitting, walking, talking, children who have epilepsy and a movement disorder, children who have epilepsy, and then also medical issues in other parts of the body, like a heart issue or a kidney issue, and then children who have a strong family history of epilepsy. These are the kids who are more likely to find an answer on a genetic test. So on the other hand, if your child's epilepsy is well controlled with medications and they really don't have any other significant medical issues, we're just less likely to find an answer when we do genetic testing. Oh, I think the other thing that some families wonder about is cost. I think that's something you and I were talking about before we started the video. So it's helpful to know that there is no one genetic test that can pick up all the known causes of epilepsy. So what that means is that there can sometimes be a series of tests that's needed before we actually find a diagnosis. And each one of those tests can range anywhere from several $100s to several $1,000s. Those costs can add up when you have to have several of them. So it really just depends on the lab doing the test, the specific test being ordered. And genetic testing is not always covered by insurance. So that's one of the big factors that family think that they're thinking about when deciding whether or not they want to do genetic testing.